Good evening. My name is Kay Aubrey Shemaine. I'm the owner and director of Grand Adventures Ranch, a holistic equine wellness center in Sonoita, Arizona. This is our weekly webinars education series where we talk about light therapy and photopuncture. Photopuncture being acupuncture with light for horses. And tonight we're going to talk about using photopuncture for navicular issues. I'll talk a little bit about what navicular syndrome is in horses and how we can help with the photopuncture light therapy. So navicular gets referred to in a lot of different ways, called navicular syndrome, chronic heel pain, navicular disease. Sometimes people refer to laminitis as navicular, sometimes they refer to navicular as laminitis. Sore feet is a big part of it. In layman's term, I think of it as osteoporosis of the hoof. Okay, if you try to relate this to a human disease. And navicular issues can be brought on by reduced blood supply, repeated trauma, arthritic changes to the bone, and we're going to talk about why that happens. It can also result from inflammation in the bursa, or the fluid sacs around that bone. But in general, it is a weakening, an osteoporosis, a thinning of the bone in the hoof. Now, the navicular bone is this very, very small wedge-shaped bone right below, right above the coffin bone, and kind of acting as a pulley, or to keep the deep flexor tendon from pulling that coffin bone too tightly. Okay, and so here the navicular bone, which is really no larger than my little red dot, sits right here at that joint. It also acts as a valve for blood flow to the coffin bone, because a lot of the blood supply, as you'll see in a minute, comes right across that bone, and so it will control it. It can help control the amount of blood that's getting to the foot. Now, this is the cross section of a horse's foot after he's been dissected, and you can see that we have a very long deep flexor tendon that comes all the way along the back of the foot around that navicular bone, and it attaches to this very sharp pointy bone, the coffin bone. All right, and this navicular bone sits right up underneath, and you can tell how porous it is. Tremendous amount of blood supply coming through here, and all of these ligaments coming around put it in a huge amount of stress on that coffin bone and pull it back toward the heel, and so that navicular bone is helping to act to prevent that. Now, this is not a healthy foot, which is why we see that bone pointed down. Here's kind of a graphical look at all of the different blood supply that's coming down into the foot. And you can see a huge portion of it comes right through that navicular bone. And because we don't have any muscle, all right, or soft tissue, the blood supply, those veins and arteries and so on are right in the bone, which means they have a lot of direct contact with very, very porous bone. Now, what happens is when the body gets too acidic, it starts, if it can't get the alkalizing minerals that it needs, or the fat that it needs from the diet to help keep the body alkaline, it will start robbing minerals from the bone, in this case usually calcium. It's going to start robbing it from the bone, and that bone loses density, osteoporosis in humans. One of the reasons we have such a high level of osteoporosis here in the United States is we eat a very acid-forming diet, very high in protein and starches and sugars, and not enough vegetables and healthy fats. Same thing is happening with our horses. They are eating diets that are minerally depleted, usually far higher in protein than they should. And we've decided that fat, or at least usable fat, is bad, or we pull all the oil out of the whole corn and so on, and they're not getting the fats to alkalize out their diet. So the body has to start robbing minerals from the bone. What bone is closest to the blood supply? This poor little navicular bone, that little wedge sitting under the foot. And the horses are often just standing there. That blood is right running through that bone, and it makes it very susceptible to fracture, both from being so small and porous and also from the large stress that gets put on it by that deep flexor tendon and the other tendons that are wrapping around it. So it's the first thing to become very inflamed and to stress that the bursal sacs around it become inflamed, the ligaments and tendons around it become inflamed, and the bone itself becomes fragile and it easily fractures. That, of course, puts the horse into an incredible amount of pain. So the horses that are most prone to these navicular issues, of course, one's on a high-protein diet or poorly mineralized diet, and horses stressed from landing on those legs and turning, roping, barrel racing, jumping, cutting. Horses that are landing, and usually we see navicular more often in the front feet than in the back, though it can happen in any of them. And horses with small feet tend to have more navicular. And what have we done over the last 40 years? We've decided that quarter horses with little bitty tiny feet are prettier. Or show horses, we've gone for these very small round hooves, and that makes for a smaller navicular bone. That bone's going to be easier to break in the long run. So what can we do? Obviously, diet and nutrition come first. When horses are fed hay that's grown on soil that's minerally depleted, the only thing we're putting back in to fertilize most soil is nitrogen, potassium, and phosphorus, excuse me. And if we're not putting anything else back in, then the soil doesn't have it to give it up to the plant. So those plants, the hay that we're feeding is usually very minerally depleted. So a good daily vitamin mineral, and then free choice minerals, calcium, phosphorus, magnesium, and so on, along with an alkaline diet, grass hay, low protein or low grain diets, okay? Those alkaline diets will help the body to lower its inflammation level, not need to rob calcium from the bones. But you can't do that overnight, and we can't put the bone density back down overnight, especially if we don't change the diet. So how can we help immediately with these horses that are in a lot of pain? I love using photopuncture for this, okay? We can rapidly reduce the pain. We can support the kidney's ability to balance pH levels, which is key here. pH is tied to itis. The more acidic the horse is, the more itises, arthritis, bursitis, tendonitis. Same for people, same for dogs, same for horses. If you're more acidic, you're going to have more itises. Navicular disease is not called navicularitis, but it is an inflammation, an itis of the navicular bone and the whole hoof. Okay. Also, photopuncture can help to relax the tendons and ligaments, which will reduce the stress on that navicular bone, so it won't break won't break again, and it won't hurt as bad when it's being pulled by those tendons. So here are the points that I recommend for you working on navicular. First, the kidney is key. Like I said, I always go for kidney points when I'm talking about pH in the body. So kidney 1, the very first kidney point, is right between the heel bulbs of the back foot. We've literally just put our lights, whether it be a photonic torch or our photopuncture system lights, we put them right there at the heel bulbs and start stimulating and supporting that kidney meridian. Then we come up and we do kidney 3, which is right there on the inside of the hock, above the bone, right at what we call the Achilles tendon point on the person. So if you know where your Achilles tendon is in your heel, that is the same thing here on the inside of the hock of the horse. Okay. Then I want to help strengthen those bones. I want to get the bone density back up. Our master point for bone is bladder 11, right there at the top of the withers. There's a little depression. It's a wonderful point for strengthening bone, helping to repair broken bones. So, of course, it's key for navicular. Pericardium 9. Now, this is the right between the heel bulbs on the front hoof. So, whether you're going to the back hoof or the front hoof, go between those heel bulbs and start treating with the lights. Pericardium 9 is a master point for hoof and the forelimb and forelimb pain. And like I said, most navicular happens in the front hooves. Then we have governing vessel 4. This is right below the rib cage, on the midline, right there on the spine. Okay? And it is a very important point for lowering overall body pain, helping the body to stand upright, and to strengthen bone deficiencies. Again, when we have weak bones, very important point overall. And I really want to do something about those ligaments and tendons to help balance them, take the pressure off the bone. So gallbladder. When you're thinking ligaments and tendons, think gallbladder, gallbladder, gallbladder. Even though a horse doesn't have a gallbladder, energetically he has a gallbladder meridian. So this point, gallbladder 25, is just above where the ribs start to turn back toward the spine. You'll find a little depression there if you go to the last rib just before it turns. And then gallbladder 39, about halfway, or excuse me, a third of the way up from the hock to the stifle, right on the bone. Okay, it's actually technically right in front of the bone. And we treat those points every, I should have said 48 to 72 hours. I'll check that. I usually will start by scanning and treating and doing a full photopuncture session if that's available to you. If all you have is a photonic torch, that's fine. Just start treating those particular points. You can do it every day, but on an ongoing basis, you're probably going to treat every 48 to 72 hours. If they're in more pain, do it every day. At least do between the heel bulbs on the front and the back feet. That will help with the pain greatly. Okay? And exercise, light exercise is good. We want them walking. We want them to, whether you're hand walking them, ponying them, if they will do round pen work at a walk, great. But we don't want high stress on that until we've got this under control. We've reduced the inflammation, and they can start moving without pain. And we do have a new navicular chart, so if you need those points all in one place, you can get the navicular chart from our shopping cart, from the photopuncture.com website. You can go to shopphotopuncture.com, or you can go to here, photopuncture.com/s/EEP, or equine energy point charts. Okay, so I'm going to open it up for everybody. Okay, everybody, have unmuted. Any questions that come up? Has anybody here had any recent dealings with navicular? I know you have, Sandra. Anybody else? Nobody's got a question. Nobody has any problems with navicular at all.
Okay, I got a horse out of turf. I trimmed it. I had the horse trimmed him back too short, and he seems still lame a little bit. He's real floppy when he moves.
And do we have any indication whether it's navicular or laminitis? You're here in Arizona, right?
Yeah, I'm at Turf Paradise.
Yeah, and of course here in Arizona, my trimmer, he figures that probably 70 to 80% of the horses he sees have some significant level of laminitis. So you could also be dealing with that. but I could still work with those hoof points to lower the inflammation. Those
Okay.
especially in between the heel bulbs on both feet. We're going to do a laminitis class in a couple of weeks, and the points are a little bit different, but the ones here wouldn't hurt.
Okay. Yeah, I would like to get a chart. I didn't get that email address to order
Sorry.
it. Can I do it on credit card? I'd like to order a chart.
Okay, well, tell you what, if you want, give me a call after, or all you have to do is go to shop.photopuncture.com, and the charts will be up there as well, but just give me a call afterwards, and I'll help you out with the order.
I sure will. Thanks,
Okay.
Kay.
Any other questions from people?
Okay.
Yeah.
I don't know about anybody else. I'm having a hard time hearing you. I do have a question. I had, sorry, the voice reverberating back at me. Was trying to determine the difference.
We have some sort of horrible echo. Sorry about that.
Sorry.
This usually happens when somebody's cell phone is echoing back to us. This is Sandra?
Yeah, I'm going to *6 myself because I know it wasn't me. But hang on, I'm going to mute.
Okay. Somebody else pop in here and we'll check. Nope, it certainly was not Sandra. Sandra, you can unmute. I'm gonna mute everybody and then unmute Sandra real quick. Sandra, go ahead and come off mute and try your question again.
Okay. Hi. Okay. Where those points are, the kidney 3 point that you highlighted today, that point has been chronically showing up even once I got to the third treatment when other points were disappearing. So how do I know if it's definitely kidney 3 or if the horse has a tendon issue there, or a hock issue per se? How can I tell the difference?
You can't. That's that's the quick version. Let me go back up here to point that she's talking about. There is no simple answer. All right, that's the joy of Chinese medicine. You don't get to say, see this point, this always means this, because it doesn't always mean anything. Okay, in general, this point is a master point for hindquarter issues, for hock issues, for pH issues. Remember that, now, for those who don't know, Sandra does a lot of work at high-end facilities, New York, Connecticut. These horses, people show up to ride their horses already groomed and saddled and perfect. And these horses, from what I've been finding out, are fed a very acidic diet. So I wouldn't be surprised if it was always hot if they've got pH issues. But pH issues can also, it's like which came first, the chicken or the egg. Their overly acidic body could also cause chronic hock issues. So that's where you have to go with other evaluation of the body to know what's going on. You sent me the picture today. She sent me a photo of exactly what she's talking about. Here's one of the horses. This is the horse she was talking about. You can see we're right here above the hock. Well, without all the other points that might show up on that horse and without an evaluation of that horse, I honestly can't answer your question. Sorry to not be more helpful.
Well, the points changed. This is the third session. A whole bunch of stuff disappeared, like, PC1, and there's still a large intestine 11, might have been a lung 6. There's one thing on the barrel I'll have to show you, so I wasn't sure. It was kind of low down on the barrel.
Uh-huh.
You know, there was really nothing. I'm trying to think if there was, yeah, nothing else on the back, nothing else on the hocks.
That's where a
lower,
series of photos can really help. Okay, so we can take a look at the whole horse,
right.
and you know, they're really, one of the things I encourage students to do is take this as feedback, but not try to use it as diagnosis. One, we're not diagnosing anyway, and B, we're just looking at what comes up and what changes when we treat it. Okay, what changes over time. It's just information, and don't get too caught up with labeling it. Okay. And when in doubt, ask the horse. Is this hock? Is this pH? Is this kidney? Ask the horse. Sandra is trained in muscle testing. I know she knows how to do that. All right.
Thank you.
No problem. Okay, I'm opening it up back up again, and everybody's off mute. Any other questions that came up? I see we have a couple new people on the call tonight. We'd love it if you'd introduce yourself. Let us know who you are and what brought you to the call, and what interests you on working with horses. Kathy, I know this is your first call. Why don't you tell us about you? Looks like you've self-muted.
Can you hear me now?
I can.
Oh, okay. Well, my sister and I just have been doing a lot of research on this, on the lights and stuff, and we're very interested in trying to help our horses and friends' horses and all, and so we're just getting started and looking forward to learning everything we can.
Awesome. And where are you guys from?
New York.
New York. Well,
Upstate New York.
that's right. Well, you can connect up with Sandra. She's right there on the edge there with Connecticut, so there's some good resources out there.
Okay, thank you.
You're welcome. I see Betsy's on. Betsy, you lurking, or you want to say hi? If you're speaking, we can't hear you, so.
Wait.
Go ahead. Okay, well, it may be a short call. I guess I must have really explained that well. If nobody has any questions on navicular, it can be very, very difficult to, from a diagnostic point of view, to tell the difference between navicular and laminitis. Again, don't get caught up. We know it's pain in the hooves. They are both tied to overly acid conditions and inflamed conditions of the hoof. And laminitis, even more than navicular, is tied to, well, it's tied to how the body deals with acid and toxicity, okay? And we'll go into more of that when we really discuss laminitis. But in general, I usually refer to laminitis as gout and navicular as osteoporosis. And if you don't know what those are, then let me know. But that's a very simple way to keep the two clear in your head. Okay? So this was the short one tonight.
I do have a question, Kay.
Oh, jump in, please.
Is there ever a time that you would just use the light right on the sole of the foot?
Sure, sure. In fact, I've got, for my older system, I have light pads that we'd have the horse stand on. It's still possible to find old Bioscan boots that were a boot that people used to buy because they were so phenomenal, specifically for navicular, where the horse would do like a 20-minute session. But if you have a photonic torch or just the light therapy pack, you bet we put the lights right on the sole. Horses are not as willing to stand for that for minutes or two, especially if the other foot is very sore. And from a Chinese medicine perspective, we can get just as far treating a ting point, which are the 6 points around the coronet band where the different meridians come in and terminate or start right there at the hoof. Okay? And one of the things you learn in the CPT class is to go in and be able to feel where those ting points are and to know exactly where to treat. But it's never bad to put your lights right there at the coronary band and get circulation going, get energy and chi flowing back through the leg, end the stagnation, help lower the inflammation. Okay?
Okay.
Definitely, if it hurts, put light on it. That's a good basic starting principle. Oh, Betsy typed out hi. Hi, Betsy. I guess you can't talk out loud right now. Any questions, Betsy? It helps if I sometimes check the chat window. All right, well, the next upcoming photopuncture class is November 12th to the 17th. It'll be here in Arizona, here in Sonoita. We've got 4 places left in it. We've got somebody coming from Australia. We've got people coming from all over the country for it. The class is 6 days. If you do not have equipment yet, that's fine. We will provide equipment for people taking the class, and you can get the equipment later. You can start off with just photonic torches and then work up. I can guarantee you once you've played with a scanner, you're going to want one. But it's a great place to start. And then we'll have another one, I think, in January. Don't hold me to the next date. It's out there somewhere. So, okay, guys.
Okay.
One last chance for questions.
Sure. The woman who's in New York that's just getting started, if you want my number, I can certainly provide it to you if you need any.
You know what? I've got
help.
Kathy's information. Kathy, what I'll do is I'll email your information or Sandra's information to you. How's that?
Okay. Thank you.
Because this is a recording going out, out on YouTube and so on. So I'll just make sure you guys have ways to connect.
Thank you.
All right, everybody.
Thank you.
Have a great week. We'll talk to you next week.
Thanks, Kay.
Bye-bye.
Bye.